Hello, everybody. I've been writing notes so that I would remember everything and whatnot. So last time we talked, I was going in for brain surgery. That was a pretty scary event. I guess my doctors were very confident. And as I was going back, I was talking to the anesthesiologist, and she says, "Oh, he's done lots of them." And I explained to her that that's fine, but it's still awfully scary because this is my first. Oh, she was going to sedate me and everything. And she did. She did a great job. Matter of fact, I was awake because you can't go to sleep or you can't be completely out because they want to make sure your brain's still working. But at the same time, you can't be able to feel anything. And quite honestly, I personally wasn't able to react at all. Maybe in my head I could react, but physically, like move around and stuff, there wasn't a whole lot of that going on. So anyhow, brain surgery apparently went really well. It was scheduled for an hour and a half. By the time we went in, got sedated, everything, they went in, did the surgery, sewed me back up, cleaned me back up, whatever they needed to do. And that's what they did. So that only took 45 minutes, which I guess is really good. The other thing that, well, I guess after that, you have to lay vertically for 2 hours so that the blood can, flow back the way it's supposed to or whatever. And then you sit for another 4 hours. You can sit up or whatnot, but you don't move for another 4 hours, just kind of hanging out in recovery. So that's how that went. I was under the impression, as a matter of fact, I was told by my neurosurgeon that he was going to keep me for 24 hours. While I was there for 24 hours, my geneticist was supposed to come see me, my liver doctor was supposed to come see me, and he was going to come visit me. That didn't happen, which was kind of disturbing to me, I suppose. Basically, he called my wife. He didn't come visit us. He called my wife and told her surgery went real well, he'd be out, do this, and this. And so, okay, fine. And so we did all that, but he never came. And they let me out after 6 hours in recovery, and so nobody got to see me, which I was a little disturbed by. And so I started making some phone calls and talking to the liver doctors, because they're really the ones I was wanting to see, because this lactulose that they're putting me on and this Dioxifan is flushing my system of the ammonias, but it's also flushing my system of everything else. Potassium, giving me leg cramps at night. I would imagine some sort of collagens or something, which is causing my knees and things to ache. And things like that, just, I guess I've only lost like 10, 15 pounds, so that's not as much as I thought I had lost, but at at about 160 pounds now. That's less than I can really lose. Because I've got a 6'6" frame, and at 160 pounds, it's a pretty little guy. So then after we got out of surgery, and I guess my wife went down and poured her heart out to patient services, and they sent a liver specialist that was probably the most disturbing encounter I've had with the doctor yet. This guy, while I was talking to him, he just kept interrupting me. Well, this is after surgery. I'd been on the phone with a resident liver doctor, and he told me that regardless of who I go see, they're never going to change it. I'm just going to be on this lactulose and Zaxifan for the rest of my life. I really didn't like those answers. So we, my wife had gone, and I was apparently after anesthesia, depression is not uncommon. And I was pretty down after he told me that. And so then my wife went down and talked to patient services, and then we had that liver doctor come up. And when that liver doctor came up, he kept interrupting me. And I didn't really care. I'd pretty much given up on the liver doctors at that point. And my wife got a little excited with him. She didn't stand up or anything. She just kind of raised her voice and started to argue with him. This guy started grabbing the curtain behind him, screaming about being attacked and having to leave. He wasn't safe in this environment and things. And it's like, you're a professional. His students their mouths were dropping and in disbelief just about as much as my mother, who was also there and just didn't say a word. She couldn't believe it. And I eventually called my wife down and told this guy, hey, look, you know what? I don't expect you to do anything for me. I'm pretty well done with y'all. So if you want to leave the room, by all means, there's the door. Well, he calmed down a little bit and started talking to me alone. He would only talk to me, and she eventually just kind of got up and left the room. My wife did. So, I don't know. He had a lot of, it was really hard to get around his ego. His ego took up about 3/4 of the room. But he did have some good things to tell us, some different things than what I had been told. Like, well, he did say something about stress causing all this, which I completely don't believe, because there's so many systematic things wrong with my body that until they can fix all them, they can't tell me the stress is causing my high ammonia. And that is also what my family physician said. That's quoting her, actually. But but he did tell us a few things, and as far as there's surgeries that can be done and things like that. So that's was encouraging. I'm feeling really good here today, and so that's always a positive. I went to Sumner later on after that. Well, it took about a week for me to get with my family physician in Sumner, and I pretty much laid it all out to her. Oh, that was the other thing, was my mother went down to go get my prescriptions from the discharge pharmacy in Iowa City, and they handed her aspirin, 325 milligrams of aspirin. Well, before I was on 2 blood thinners. Now they just upped my aspirin by about 300 milligrams and didn't put me on the Clavix, which I'm not sure if any of y'all have a clue what that is. It took me a little bit of research. But anyhow, I went back to my pharmacy here in Owine on the following Monday, which is 5 days after my surgery, after I was able to get up and walk and do normal things again. And they says, "Oh, we got another medicine here for you." And I says, "Oh yeah, what's that?" And they said, "Oh, it's Clavix." I thought, gosh, I should have got that with the other blood thinner if I was going to take it. I didn't know I had to take them both. So I called Iowa City, talked to the neurosurgery, and there was another doctor, not the one that operated on me, but one that I assume understands just as much as my surgeon. And he says, "What? You haven't been on that for the last 5 days?" I says, "No." He says, "Well, how do you feel?" "I feel all right." "You haven't had any numbness or tingling of the fingers? You haven't had any severe headaches?" I says, "Well, I've had headaches, but not like brain-splitting headaches, not like an aneurysm exploding headaches." And he says, "Okay, well, you get on that, and you stay on that for 3 months." Come to find out, that Clavix was supposed to be helping the aspirin thin my blood so that my blood did not clot up around all this new hardware in my head. Little bit disappointed with Iowa City on that aspect also. Mistakes are made. Humans do err, but I'm starting to feel that that hepatologist that came in and visited me is not the only ego I have to work around down there. Which is why I am very happy with my physician in Sumner. She's rather new to the game, but, and that seemed kind of a little bit scary to me, but compared to dealing with all these doctors that already know what's wrong with you before you talk to them, they already know what your problems are before you talk to them, somebody who will listen to you, write down what you say. If you give them a website like the Marfan.org, which I gave to my doctor, they will write it down and look it up. People who, are kind of new in the field are still willing to do the research, where some of these old cats that are set in there, they just don't have any interest in, they already know everything. So I went to Sumner, and my doctor basically told me that Iowa City is a phenomenal hospital. They've got a lot of great minds. Those great minds do not have great mouths. They do not communicate very well with the patients, with other doctors, and they are also a medical or a teaching hospital, which means that when you go down there, if there's a surgery to be done, they don't really explain a whole lot about the surgery, the risks, the possibilities that it'll work. They just say, "Well, we're going to do this surgery." According to my physician up in Mayo, they will talk to you and explain it to you. But Iowa City just sees it as another opportunity to teach, and which is what they're there for. But it's not always the best answer. I don't think Iowa City is a bad hospital. It's a very good hospital, probably the best in the state. But with all the different body systems and that anatomical systems, whatever, that I have problems with, I need doctors that'll talk to one another. And my family physician agrees, and therefore she's referring me for a second opinion up in Mayo. Which I am excited about. I have had so many people tell me that I should be in Mayo. Which brings me to another aspect. Right before I went to my appointment, a client of mine was talking to me about my conditions and told me that there was a guy that has died from Marfan's recently in the area, and asked if I would mind if she shared my story with his parents. Well, I says no, and so the very next day, these people came and visited me at the shop, and they looked me over, and his name was Rodney Hamlin, I believe, and he, back in 2011, his aorta started bleeding out like most Marfan people do, and eventually, and they took him to Manchester. Manchester diagnosed it. And then I'm not sure if it was Manchester or Iowa City, they did the surgery to fix it. And it was fixed. Great. But then something about, I think it was the blood that got down into his intestines and clogged things up down there. And it basically rotted. And he went back to Iowa City because they released him. He went back to Iowa City, and his blood pressure was so high I think they put him in a coma, or he went into a coma or something like that. But they were going to wake him up on Sunday, and he was brain dead. And his father feels that Iowa City just watched him die, which is kind of disturbing. And so therefore more of a push for me to go to Mayo. Mayo actually has a division that works with Marfan's people, because 1 out of every 5,000 people have Marfan. The interesting thing about this is he would be 50 on February 20th. And I will be 39 on November 4th. But we're a little bit different in age, but we grew up 13 miles away from each other. He grew up outside of Lamont. I grew up outside of Aurora, which is kind of interesting. I don't really think that it has anything to do with the environment as far as anything I've read, but my family is tall, thin. He was the first one that looked like me and him in his family. Apparently he has 2 daughters who are being treated now, and now they know what they have, so they are being monitored, which is good. Gives me a little bit of fear about my son William. He's tall and thin like me. Well, he's not quite as thin, but he's not a very big guy. Well, he is a pretty big guy, but you know what I mean. We've got some really great friends who have continuously helped us out, and I learned last night that we have a great community too, because other than these guys coming and talking to me about all this stuff, I went to a business after 5, which is something the Hawaiian community does with its business owners and chamber members. And I had a lot of people that knew about my case and concerned and asking, and it was kind of nice. So this is Marfan Awareness Month, and I want to inform you guys a little bit about this life-threatening syndrome. What it is your connective tissues do not form correctly, and therefore you probably are tall and thin. Those are 2 big signs. But just because you are tall and fat, or short and thin, or short and fat, doesn't mean you don't have Marfan's. It's just a lot less likely. Or one of the diseases that are very closely related. There's quite a few of those also. So nearsightedness, and it gets progressively worse, but nearsightedness, notice the glasses, yeah. So heart issues. I've had a mitral valve prolapse since I was 2. Let's see. Trying to remember what the other things are. There was a couple of neat little tests, and I will see here if I can set the phone down. If you can reach your, let's see, how does that go? If you can reach your hand around your wrist and cover your fingernail, your pinky finger, with your thumb, which I'm not demonstrating very well this morning. My son can actually do it much better. But anyhow, if you can cover your pinky finger with your thumb, that is a good sign. Or that is not a good sign. That is a sign of Marfan's. The other one that I learned after reading online is if you can make a fist and your thumbnail will stick out, that is another good sign. Basically, extreme flexibility. I'm not trying to make you guys motion sick, but I can bend my fingers, at least that one, way back. And I'm not sure if that has something to do with it, but I'm pretty sure it's not normal. The guy that I was told about, this Rodney, could reach his hand around his head and put his arm behind his neck and reach that same ear, like put his arm all the way around his neck and touch his ear. Stretch marks on the back for no apparent well, they're usually on your back, but stretch marks for no apparent reason. Curvature of the back, either a caved in or really sticking out chest, either one that is caved in or one that sticks out abnormally. Mine's flat. Speaking of flat-footed. And then long fingers, toes, any of these things. It wouldn't hurt to at least go talk to you, maybe look up marfan.org, maybe talk to your physician, maybe find a physician to talk to. There is a part on that marfan.org that actually gives you doctors, a list of doctors that specialists that you can talk to. And Marfan is Marfan. As far as the shunt in my liver, I'm not sure that it would really be a problem if there weren't such blockage in my portal vein, or not connecting, I guess, in my portal vein. They still haven't given me a exact deal on which it is, but genetic testing. I did get approved for my genetic testing, and it should be back in about 2 to 4 weeks. So, though they are about both of my geneticists, the one that I've been working with, and the head of the genetics, which has seen me a couple times, both of them are pretty sure that I have it. 80-90% sure that I have it, but it has not been genetically confirmed yet. Soon as I get, there's 25 markers they're looking for. I don't understand genetics or the markers or anything, but anyhow, there's 25 markers that they're looking for, and when they decide which ones of those 25 markers I have, then for a less expensive, faster test, they can look for those exact markers in my children, my parents. Because, yeah, I'm kind of concerned about my mother because she looks quite a bit like me. My dad's a tall man too, but he is very, very big. He's a big, strong guy, and he definitely he's definitely a carrier, but I don't think it's dominant in him, but he should probably be tested also. So back to the medicines that I'm on and things, why they have put me on all these things that are taking these deals out of my body. Now, this isn't a commercial or anything, but I have been taking Thrive now for a couple years, like a year and a half or something, and it is really where the food that I eat, when it's broken down, it doesn't get brought into my system as well as most of yours. I was reading about on a scoliosis website, which is basically how they're treating my liver, as if I have scoliosis with the lactulose and the Zaxifan. These people have to drink protein shakes, Ensure or something like that, to keep from withering away. Well, I've been using my Thrive. I've been taking my shake and pills and patches, and that has really, really helped me. Now, with an ammonia base level of 70 to 90, my body has been building a tolerance to this poison and probably a lot of other things for a long time. I don't know. So I always have had a hard time sleeping. I don't know if that's my Marfans or that's my ammonia levels or both or none or what. But I've been having these problems. And for a little while, I was on Meditolan. It took me, 6 months, something like that, to build up a tolerance to that. So then there was a lot more late nights, and my wife started Thrive, and the first thing she put me on is this thing called Rest. And it knocks you out. It is great. Took me almost a year, a little over a year, to build a tolerance to that. And now if I take it, like a couple times a month, it works great. but every night I've built a tolerance. And so I've got a friend who sells Young Living oils, and those oils have really helped me sleep. I'm just, these are things that have worked, and it's really helped my condition. And anything at this point that will help and that my doctors approve of, because they approve of all of this, I'm in for, anything that'll help. And then I've started to get more joint pains, and so I've been using some of the Thrive additives, and that has really been helping with my joint pain. So it's definitely been a learning process. A little bit at a time, one day at a time, sometimes one moment at a time, but it's just how we get through, and I've really started to value things that I took for granted before. And that leads me into all you guys. I really, really appreciate you taking your time, listening to me, caring about me, stopping me in the street and talking to me. It's been encouraging. And so thank you. And that is all I have for today.